Mr. Santana.
Good afternoon. My name is Miguel Santana. I'm the City Administrative Officer for the City of Los Angeles. I've been the CAO for the city for nearly 7 years. Prior to being CAO, I actually worked at the county for over 15 years as Deputy CEO in my last job, specifically working on social services and homelessness. As Phil indicated, the city and the county have worked in alignment in developing for the first time a comprehensive strategy around homelessness. And it wasn't a coincidence that the Board of Supervisors and the Los Angeles City Council adopted the strategies on the same day. It was intentionally done that way to illustrate a coordinated approach at the highest level and a commitment to addressing this issue. And to echo what the Senator stated earlier, the strategy really starts with a overwhelming commitment from the political leadership that, in fact, homelessness can be addressed and there can be strategies to reduce the numbers and prevent them from increasing into the future. And it's both the city and the county have demonstrated that commitment. Much of what our strategy is you just heard from Phil, because it's not by accident, because we developed it together. But to think about it on a comprehensive level as a system, we sort of drew this map to provide you a sense of how these strategies come together. So as Phil indicated, on the preventive side, there are a number of causes to homelessness. Some created by our own systems, the length it takes to build housing, for example. Some created through economic hardships and the affordable housing crisis that currently exist in Los Angeles and other parts of the state. And then some are through gaps in the various systems, in the foster care system, in the healthcare system, in the justice system. And then, of course, some are individual issues that each individual homeless confronts. Homelessness has a variety of different beginnings, and at the core of it is a solution that seeks to address those individual unique issues that result in homelessness through what, as Phil indicated, a coordinated entry system. What the city and the county have committed to do is to coordinate one response in how you connect one human being to another human being so that that interaction results in placing that person into housing and keeping them in the housing using the Housing First strategy. For us, Housing First is three things. It's a person connected to another person. It's a system itself, so that no matter how you are confronted with homelessness, how you interface with government or the nonprofit community, there is one system that leads you to the same direction, whether it's through our library system or through public safety or any other entry point, sort of this no wrong door philosophy. And then finally, it is a philosophy unto itself. It's a philosophy of doing whatever it takes to help that individual move into housing and to stay into housing. And so we're committed to both funding a system through LASA, which is the joint JPA between the city and the county around homelessness, and working specifically with the nonprofit community who continues to provide that outreach today. And then, of course, supporting that individual through specific housing programs. Permanent supportive housing has been proven to be the most effective response for those individuals who are chronic. Rapid rehousing is also particularly effective for those who are been in their homeless situation is temporary, where intervention tied with some supportive services can ensure that they are placed into permanent housing into the future, and of course specialized housing for unique populations. And then all of that wrapped around supportive services that is performed by the county. Again, those are the principal strategies: preventive, centralized case management, housing, and ongoing support. Where we believe the state could be particularly helpful is in providing funding that helps strengthen the infrastructure of centralized case management as an example, particularly for the immediate crisis that Los Angeles is facing. Within the city's boundaries alone, we know we have 26,000 individuals who are homeless. We just completed the homeless count. It's very likely that those numbers are going to increase when they get announced later this year. We believe that there can be an immediate focus on strengthening the infrastructure of outreach through one-time money and attaching that outreach with rapid rehousing. Rapid rehousing becomes an intervention that is tied to supportive services and it could be time certain and as Phil indicated has proven to be an effective strategy. And then finally, we also believe that further assistance could be done as we engage in permanent supportive housing, particularly in the bricks and mortar that needs to be invested in as we move people from transitional housing to permanent supportive housing onto the future. One of the unique things about the strategies that you see before you is that for the first time, the city and the county, LASA, and the nonprofit community have identified what our respective roles are. We often in the past have stepped on each other's toes, engaged in sort of, blaming each other for the current crisis that we're facing. Through this collaborative effort, we each respectively understand what our responsibility is and are coordinating how we respond to it in concert. So in our strategy, we outline specifically how the city and the county, LASA and the nonprofit community would be building the infrastructure of coordinated entry. On the city side, particularly around housing, we're committed to addressing and streamlining our own housing planning processes to allow for expedited housing to be developed. We're also committed to identifying property, many parcels that are owned by the city that are underutilized, to make those parcels available for housing. We're committed to addressing the issue of poverty by increasing the minimum wage. Again, this is something that the city and the county did in coordination, days from each other, adopting our own respective minimum wage ordinances that are consistent with each other, and of course supporting a network of public services given our respective responsibility. And one example is that we're working closely with the county on the idea of sobering centers, particularly in high concentration areas of homeless individuals, to provide alternatives to the traditional models that currently exist and points of intervention, as an example. Like this county, the city has a number of strategies. These are just a summary of the various strategies that exist. Of course, starting with a no wrong door philosophy, this idea that the city can in fact be a point of intervention in the various ways that we interface with the homeless population, an investment in the coordinated entry system. We've also discussed ways to maintain this continual collaboration beyond just the establishment of this plan through a shared governance model that is in partnership with the county and the other 87 cities in the region, as well as the school district. There's been a tremendous amount of emphasis placed on the immediate crisis, improving and addressing the quality of life of the homeless individuals today, as well as those who live inside homes in the same communities, by creating better access to facilities, establishing voluntary storage capacity throughout the city, working in coordination with LASA for borrowing models that we've seen in San Francisco and other areas to help people maintain themselves. Of course, a huge investment in housing as outlined in land use, and then a few other additional strategies. So with that, I'll be happy to respond to any questions.
First of all, thank you so much, Mr. Santana. If we don't ask questions now, we might be going back to it. later on after all the presentations are done. But I'd like to also take an opportunity and say thank you to Mr. Mullen for showing up. Mr. Mullen, do you have any comments you'd like to make? Thank you.
I have the honor of introducing our next two speakers to round out this first panel, two additional state experts on this topic. Our next presenter is someone who has been working with the Corporation of Supportive Housing for almost 10 years. She is the Associate Director of California Policy at the Corporation for Supportive Housing, coordinating and advancing efforts to implement a statewide policy agenda across the variety of issues that we know impact people experiencing homelessness. Thank you for being here, Sharon. And the fourth speaker on this panel is someone who I've known for many years, who has served as the executive director of my city of San Francisco's Human Service Agency since October 2000, when he was appointed by then Mayor Willie Brown. From 2004 to 2008, as the executive director of that agency, Trent Rohrer served as Mayor Newsom's point person on homelessness, chaired the mayor's interagency homeless cabinet during a time period when our city developed our 10-year plan to end chronic homelessness and created over 3,000 supportive housing units for our homeless families. I'll just add two more things. Trent, I still wish you had ended homelessness in 2008 before I took office, but I'm glad you're still working on it now. And Mr. Rohrer is someone who works in San Francisco, but I know lives in Mr. Thurman's district, which I am understanding is a broader trend that we're starting to see with many of our public servants, given the affordable housing crisis that we're seeing in San Francisco. But with that, I'd like to turn it over to Sharon.
Thank you, and good afternoon. Thank you, Mr. Chairs and members. I've been asked to describe Housing First and give a little bit of background about Housing First programs at the state level in California. Housing First is an evidence-based model intended to end homelessness by housing homeless people as quickly as possible without precondition. A psychiatrist in New York, Sam Simbaris, created the Housing First model in 1992 based on the premise that homeless people cannot address health care needs until and unless they are housed in a permanent, stable place to live. Since then, research has proven Sam Simbaris correct. We know that housing is the single biggest indicator of the ability of somebody to improve health outcomes, both on the medical side and behavioral health care side. And we know that to be true in California as well. One study in California, for example, that looked at Medi-Cal beneficiaries showed homeless beneficiaries continue to increase their inpatient costs while homeless, even though receiving thousands of dollars in services every year for care coordination and intensive health care services. Once housed, these same individuals were able to decrease dramatically their emergency room use, their inpatient admissions, and the length of their inpatient stays when they were admitted. Other studies similarly link Housing First to reduce recidivism, increase income, and reunification with kids in foster care. Housing First has several key components. Housing should not be contingent on participation in services. Landlords accept applicants regardless of sobriety, treatment completion, or good credit or rental history. Similarly, once housed, a tenant's use of alcohol or drugs in their own apartment, as long as they are complying with their lease terms, should not be a basis for eviction. Services promote housing stability and engage and educate tenants on avoiding risky behaviors and connect tenants to evidence-based treatment. And tenants have a lease and enjoy all the rights and responsibility of tenancy. Housing First programs fund two key strategies, and both of the earlier witnesses talked about both. For 30% of homeless people who are experiencing chronic homelessness in California, or who are cycling between institutional settings and homelessness, supportive housing is the proven intervention and the appropriate intervention. Supportive housing, as you've heard, offers long-term rental assistance that helps people in deep poverty afford their housing and provides intensive wraparound services to help keep them stably housed. Studies over the last 20-plus years demonstrate supportive housing is less costly to public systems than chronic homelessness and keeps over 90% of tenants stably housed over long periods of time, even among those who have been homeless for decades. For the remaining 70% of people who could exit homelessness without long-term assistance, rapid rehousing is a proven, highly effective intervention, and it is a much lower cost intervention than supportive housing. Rapid rehousing combines short to medium-term rental assistance, move-in costs, and voluntary services to help exit people from homelessness and get households back on their feet. The services include locating a place to live that is affordable once the housing transitions off of the short to medium-term rental assistance. And studies show that 92 to 94% of families and individuals receiving rapid rehousing are able to stay stably housed, no return to homelessness. In California, the Proposition 41 and Emergency Solutions grant program that Cindy Kavanaugh is going to discuss later, as well as the Housing Supports Program that Trent Rohr is going to discuss in a few minutes. They both rely on housing first strategies and supportive and rapid rehousing. A budget item you'll be considering this year, Bringing Families Home, would fund supportive housing and rapid rehousing for homeless child welfare involved families experiencing homelessness. And it employs both supportive housing and rapid rehousing strategies. Both of these strategies rely on either the availability of sufficient apartments affordable to people in poverty or enough housing vouchers and enough landlords willing to accept these vouchers to help people get into permanent place to live. Neither of these options are available in enough supply in most communities in California. We need landlord incentives to promote full use of existing vouchers. We need strategies like Phil Ansell talked about of prioritizing our existing vouchers for people experiencing homelessness. And we need capital funding to create housing in cities where housing affordable to people in poverty does not exist in enough supply. While housing first strategies receive attention in our large urban communities, many of our smaller counties and Central Valley and Northern California counties employ housing first as well. Fresno, for example, prioritized Section 8 vouchers for chronically homeless residents, and they were able to decrease chronic homelessness by 25% over 2 years. So these strategies really do work across counties in California. Some smaller counties have struggled with using capital funds because fewer developers have capacity to build there. The cost of housing is less and the economic gain of development is lower. In these communities, we also need money for technical assistance and capacity building to apply for funding and to attract developers where available housing stock is lacking. HUD, the U.S. Interagency Council on Homelessness, the VA, and multiple state and local programs throughout the nation employ housing first through supportive housing and rapid rehousing strategies. And experiences from these programs that you've already heard some of these earlier today show that investment in housing first strategies could work to end homelessness for thousands of Californians. Thank you, and I'll look forward to your questions.
Okay. Good afternoon. I'm Trent Rohr, the Director of Human Services in San Francisco and intimately involved with implementation and administration of homeless services as well. Phil Ansell talked about the importance of mainstream resources, and I'm fortunate enough to not only direct the county's Human Services Agency, but oversee the large bulk of the city's investment in housing and homeless services. So really have a ground level perspective on the importance of mainstream resources. Today I'm going to talk about housing first approach for families as well as for single adults that we employ in San Francisco and really have been doing it since the early 2000s and have a lot of experience and data that I'm going to share with you today. I do want to say one aside that to LA County and City that your plan sounds very familiar and I think is right on the mark and I'm really encouraged that it is so comprehensive, and it's touching on a lot of effective strategies we've employed in the city. So first of all, I do want to thank the Assembly for your leadership in 2014 in helping to pass the CalWorks Housing Support Program. I think most of you know that this is a housing-first approach that begins to address the long-standing problem of family homelessness and the huge barrier that homelessness presents to impoverished families when they're trying to move from public assistance and into the workforce and ultimately on the path to self-sufficiency. The CalWorks Housing Support Program is precisely the type of intervention that's most effective at not only ending family homelessness, but also in allowing the family to successfully engage in employment and other services. Expecting a family, and we see this firsthand all the time, expecting a family to find and to keep a job, ensure that their kids are going to school or that they're accessing childcare while they're sleeping in a car or they're in a homeless shelter or they're on a church floor is just simply not realistic. Unlike homelessness among single adults, which is typically marked by not only extreme poverty, of course, but mental illness, addiction, or both, family homelessness typically is really a function or solely the function of low income. And thus, the appropriate public policy response, which CalWorks HSP is to supplement the family's income with a rental subsidy that allows them to afford that housing. A lot of research that Sharon has touched on shows, though, that simply subsidizing a family's rent is often not enough to permanently end homelessness for families, which is why the CalWorks Housing Support Program is really so groundbreaking. Across the state, counties are coupling the CalWorks rental subsidy through HSP with employment and supportive services to provide that comprehensive care that families need to permanently end homelessness. In San Francisco, and I think in a lot of other counties, after a family is stably housed through CalWorks HSP, we wait until they're ready at a point to engage in employment services. And what we do is enroll them in large numbers into our CalWorks subsidized employment program. This increases the family's income and really begins to move them on that path for a permanent unsubsidized job. The idea around rapid rehousing and the CalWorks Housing Support Program is that once a family is stably employed, the subsidy is reduced over time and until the family is able to, by their own means, pay the entire rent, typically in the same housing unit that was acquired through the use of the subsidy. The U.S. Interagency Council on Homelessness often points to the need, and this again, Phil Ansell mentioned this, the need for effective homeless interventions to access mainstream systems or mainstream programs, such as Medicaid or TANF. Because these mainstream services, these mainstream programs provide the wraparound resources like healthcare, childcare, employment training, and other services to provide that whole family care that's necessary to end that family's homelessness. The CalWorks Housing Support Program is literally a national model for this type of intervention. The director of US ICH was in San Francisco, as well as the Deputy Secretary for Health and Human Services, both of whom left being very impressed what we're doing with the CalWorks Housing Support Program. So just a little sense of the data in San Francisco, and I think it's, although we have a smaller CalWorks caseload than certainly than LA, but many other counties, we have about 4,200 San Francisco CalWorks families, and we've served 192 families, 192 of them in the CalWorks Housing Support Program. 144 of them are still currently housed through CalWorks HSP. 48 of them have families have exited, which is, and the vast majority of them positively, meaning that they have secured a job, they no longer need our subsidy, and they remain housed. However, we do have about 15% of our CalWorks population, the 192, plus a waiting list of almost 450 families for the program. And so the need, even though we've been effective with almost 200 families, the need remains. Like I said, about 15% of our CalWorks families in San Francisco are homeless, and I know the state's going to be here talking about the program statewide and hopefully share some of the data that's around needs statewide. Now, for single adults in San Francisco, we've been using a housing-first approach since early 2000s, and really started expanding significantly in 2004 with the Care Not Cash program, where we redirected $15 million, $15 million in general assistance funds to master lease 1,320 units of supportive housing, where we would place those GA recipients. You know, as I said earlier, homeless single adults tend to have a high incidence of substance abuse and mental health issues and require more than just income support, more than rapid rehousing, more than just a subsidy to end their homelessness. When we implemented our Housing First model through the GA program, about 60% of the recipients had a history of mental health treatment, as well as or substance abuse treatment. The Housing First approach recognizes the need not only for subsidized rental units, of course, but what other people have mentioned, which is the services that are on site. It allows clients to maintain their housing. They can access treatment, employment services, and other necessary supports. Through this intervention, again, in 12 years ago, we demonstrated that clients didn't have to be, quote, housing ready, or they didn't have to be stable in shelter in order to be housed. We were able to place clients with significant barriers directly from the street into housing and with great outcomes. Over 95% of clients who we placed remained housed after a year. 71% of them have what we called in our study a favorable outcome, and the favorable outcome was an increase in income either through employment or through getting on federal disability benefits. 54% gained employment after being placed in housing, and 16% got on federal SSI. We did a comparison. The study compared those same favorable outcomes among the homeless population, and only about 27% of folks who were homeless, either on the street or in shelters, had a similarly favorable outcome. Again, folks on this panel have mentioned, but study after study has shown that in addition to the outcomes that I noted, placement in supportive housing significantly reduces a client's use of other systems, emergency room visits, inpatient hospital stays, use of residential treatment, mental health treatment, as well as substance abuse in residence, and incarceration. There was a study done in 1999 on the, I think in partnership with the Corporation for Supportive Housing, on the Cannon Kip Lyric hotels, and shows significant reductions in use of those other systems. So since 2004, we've expanded this Housing First program for single adults to over 6,000 units of supportive housing using a combination of local general funds, HUD Continuum of Care dollars, HUD's Shelter Plus Care subsidies, Medi-Cal reimbursement, so some state dollars for some of the mental health supports we provide, and CalFresh employment and training funds to support folks who want to get back into the workforce. It's a really good example of the way to sort of channel local general dollars into mainstream resources and leverage both federal and some state dollars. The Housing First approach isn't only programmatically effective, as I've shown with some of these numbers, at keeping people housed and helping them get treatment, find employment, and reduce their use of other systems. It's cost effective as well. When you compare it to other interventions such as residential treatment or even a homeless shelter, in San Francisco, the average cost of a shelter bed, an emergency shelter bed in a congregate facility, is about $13,000 a year. This is close to the same net annual operating costs in supportive housing when you take into account that the client pays a portion of rent. In addition to the program and cost effectiveness, the Housing First approach is the dignified and humane approach as well, and that it provides a permanent place for individuals that they can call home. Thanks again for the opportunity to testify, and happy to answer any questions you have.
Thank you so much. So with that, are there questions from members on the panel? Okay, I got a couple if you don't mind. First of all, Mr. Ansel, you were talking about the $965 million. Is that the total cost borne on the county, or as it relates to homelessness issues, or is there anything more that hasn't been accounted for in that night? In the total.
So, yes, let me clarify. First, it's only for single adults. So that figure does not include families with children. Specifically, we looked at 6 Los Angeles County departments, which absorb the lion's share of costs for homeless single adults, but it's not 100%. And the departments we studied were health, mental health, public health, which includes substance abuse, sheriff's department, probation, and public social services. So that includes both our general assistance and our CalFresh or food stamp costs. So I think it's a good indicator of the overall cost for the single adults, but what it excludes are just costs in other departments, as well as any individuals who were homeless but who were not identified as homeless in the applicable data system. So I think it's a good approximation.
And roughly, any idea per capita what
Certainly,
that breaks down to?
Sure. So the population we studied was about 150,000 single adults for whom the total costs were $965 million. But very interestingly, for the 5% of that population for whom the costs were the highest, which was just under 7,500 individuals, their average per capita cost was $51,000, and the total cost for that top 5% was $380 million. So 40% of that $965 million was spent on 5% of that population. And if I could just reconcile for a second, that 150,000 number compares to a point-in-time homeless count in Los Angeles County of 44,000. But the 44,000 is point in time. The 150,000 is over the course of a year. And the 150,000 is actually almost exactly what the Los Angeles Homeless Services Authority projects as the number of individuals who are homeless over the course of a year, because people move in and out of homelessness.
Then going back to, maybe in hindsight, I should have asked you as you were making right after you made the presentation, but slide 9, the one that talked about the exiting institutions and the 3-month bridge housing,
Yes,
as well as vouchers. You said something about LA County Board has taken action to give 35% of this year's vouchers over and 50% for next year's vouchers.
yeah.
I'm probably misphrasing that, but
Right. So these are okay.
all in all, the goal was that over the next 5 years, it's going to cover 65%.